Well, the national vaccination effort remains short of the goal set by the president to distribute at least one COVID shot to 70% of American adults. Here to answer our questions is Dr. Helen Boucher, the new interim dean of Tufts Medical School and an infectious disease specialist at Tufts Medical Center. Dr. Boucher, good to see you.
Great to see you, Ben.
So Massachusetts has one of the best vaccination rates in the country, second highest, in fact, right now, and our case numbers reflect that. So why should it matter? Why should we care about low rates or outbreaks happening in other states outside New England?
Well, it really is true that we're not all safe until everyone is protected from this virus. The longer it's allowed to circulate, the more likely it is that we'll see mutations and variants, perhaps even some that could outfox our vaccines and treatments. So it's vitally important that we double down on our efforts to get everyone vaccinated.
I think we all probably know someone who simply refuses to get vaccinated. So how do you handle those situations? And have you found a message that works for someone who's very hesitant?
Well, I think first and foremost, we listen and try to understand what the issues are. For some folks, it's still an issue that they can't find a convenient place to be vaccinated. And that's something that we all have to bear a responsibility to help meet people where they are. But then oftentimes we come back to that message that getting COVID is worse than the side effects of the vaccine. We have very, very, very effective and safe vaccines available. And we know that COVID can cause serious illness, the need to go to the ICU and death, as well as long COVID and effects that can last for weeks to months. So nobody wants to have this disease, and oftentimes talking through those concerns with people helps get them to the place where they want to be vaccinated.
So we've received a number of emails from viewers offering their theories about the holdouts, and Kelly writes this, quote, "I have to believe that many of those who are reluctant to get the vaccine are simply afraid of needles." That fear is real for a lot of people, even adults out there. What's your advice about that?
Well, it is real, and my advice is tell somebody, because we will work with you. And I've seen a number of wonderful nurses especially help walk people through distraction, injection into the leg instead of the arm, all kinds of things that help get people there. But key thing is let somebody know that that's your issue, and we will work with you to get through it.
And here's one from Robert. He writes this, quote, "I know someone who won't get the vaccine because there is no solid info from the FDA stating that the vaccines are safe for anything but emergency use. So when will they get full approval?" It's a good question. Do we know the timeline for that?
Well, the answer is any day, Ben. So that's good news. But I will just, again, highlight that we know that the vaccines that we have are safer than getting COVID based on the data that we have now under emergency use, right? We have data on need to be in the ICU and death from this disease, and we know that the vaccines prevent that in ways that are incredibly meaningful, right? At 90 to 95% efficacy that we've talked so much about. So we can be very sure of those data even under the emergency use.
And now tens, if not hundreds of millions of people have received them. All right, Dr. Boucher, good to see you. Thank you for your time.
You too, thanks.